I will talk about session 11 to 14, and this would include the steps 5 to step 10 of the 10 steps of a successful breastfeeding practices. The most common reason for mothers to stop breastfeeding or to add other foods as well as breast milk is they believe that they do not have enough milk. Does it mean that small breast means a small amount of milk production and large breast means large milk production? Well, this is not always the case. A mother health worker or her family thinks she does not have enough milk if the following signs are seen. The baby cries often. Baby does not sleep for long periods. Baby is not settled at the breast and is hard to feed. Baby sucks his or her fingers or fists. Baby is particularly large or small. And the baby wants to be at the breast frequently for a long time. Or the mother or other person thinks that the mother's milk looks thin. Little or no milk comes out when the mother tries to express. The breasts do not become overfull or are softer than before. The mother does not notice milk leaking or other signs of oxytocin reflex. And the baby takes a supplementary feeds if given. These signs may mean a baby is not getting enough milk, but they are not reliable indications. So the reliable indications telling that there is a sufficient milk intake are the following. For the output, milk must be going in if urine and stools are coming out. So after day 2, there would be 6 or more than wet diapers in 24 hours. The urine would be diluted and pale. If drinks of water are given in addition to breast milk, urine output may be good, but weight gain slow. There are about 3 to 8 bowel movements in 24 hours. So as the baby grows older than month, stooling may be less frequent. The baby seems to be alert, with good muscle tone, healthy skin, and is growing too big for his or her clothes. Weight gain of about 150 grams per week is a sign of sufficient milk intake. So it is important that you weigh the patient each week if possible. Knowing these signs will build the mother's confidence. It points out the things that she is doing well and suggests ways that she can get support in mothering. The common reasons for low milk production are related to factors that limit the amount of milk the baby removes from the breast. If the milk is not removed, less milk is made, and this is due to feedback inhibitory of lactation. These factors would include infrequent feeds, scheduled feeds, poor suckling, poor attachment. Low milk production may also be related to some psychological factors, like when the mother may lack confidence, feel tired, overwhelmed, worried, or find it difficult to respond to her baby. Physiological factors may also lead to too little or ineffective breastfeeding practices. A mother who is in a stressful situation may feed less frequently or for a short time be more likely to give supplementary feeds or a pacifier and may spend less time caring for the baby. The mother may have a good supply of milk, but the baby may not be able to remove the milk from the breast. Low milk transfer may result if the baby is poorly attached to the breast and not suckling effectively. The baby may seem restless during a breastfeed and may pull away or tug at the breasts. Breastfeeds are short and hurried or infrequent. The baby is removed from one breast too soon and does not receive enough hind milk. The baby is ill or premature and not able to suck strongly and for long enough to obtain the milk the baby needs. So milk transfer and milk production are linked together. If the milk is not being removed from the breast, the milk production will decrease. If you help the baby to remove milk more efficiently, then sufficient milk production will usually follow. The second would be the normal growth patterns of babies who are breastfed. Most babies start to gain weight soon if they are exclusively breastfed from soon after birth, are well attached and feed frequently. So it is normal that some babies lose weight in the first few days after birth. And this weight loss is extra fluid that the baby has stored during the uterine life. There is a total of about 7 to 10% of weight loss during the first few days of life. A baby should regain birth weight by 2 weeks. Babies usually gain 100 to 200 grams, equivalent to 3.5 to 7 ounces per week during the first 6 months, and about 85 to 140 grams, equivalent to 3 to 5 ounces per week in the second half of the first year. Babies usually double their birth weight by 5 to 6 months and triple it by 1 year of age. So babies also grow in length and head circumference. A properly and regularly completed growth chart can show the baby's pattern of growth. There is a range of normal growth. There is not one correct line that all babies should follow. Do not wait until the weight gain is poor to do a careful breastfeeding assessment. You start and continue with good breastfeeding practices. Practicing the 10 steps to successful breastfeeding helps to assure an abundant milk supply. Your step 3 will discuss the importance of breastfeeding and basics of breastfeeding management during pregnancy. Your step 4 would facilitate the skin-to-skin contact after birth. Step 4 also offer the breast to the baby soon after birth. Your step 5 would help the baby to attach to the breast so the baby can suckle well. Step 6 would tell us that exclusively breastfeeding is good for babies. Avoid giving feeds of water, other fluids, or foods. You should only give breast milk. Your step 7, keep baby near so feeding signs are noticed. And this would mean rooming in, making both the mother and the baby stay in the same room. Step 8, feed frequently, as often, and for as long as the baby wants, or what we call the demand feeding. Step 9, avoid use of artificial teats and pacifiers. And your step 10, provide ongoing support to the mother and ensure that mother knows how to find this support group. Third would be improving milk intake and milk production. And these are the ways. First, use your communication skills. So you have to listen to the mother and ask relevant questions. Look at the baby alertness, appearance, behavior, and weight chart if available. Observe a breastfeed during the breastfeed observation aid. You respond to the mother and tell her what you are finding. Use positive words and avoid criticisms and judgments. Give relevant information using a suitable language. Offer suggestions that may improve the situation and discuss whether the suggestions seem possible to the mother. Build the mother's confidence. Help her find support for breastfeeding and mothering. Address the cause of the low milk intake and try to remedy it. This may require you to help the baby to attach well to the breast. Discuss how the mother would be able to feed the baby more frequently. So you can tell the mother that she should breastfeed as often as possible. Point out feeding cues So the mother learns when the baby has finished one breast before moving to the other breast rather than relying on a clock. Encourage skin contact and holding the baby close. Suggest that pacifiers and artificial teats, including nipple shields, should be avoided. Suggest offering the breast for comfort if the baby is unsettled. Suggest avoiding or reducing supplement use. If the milk supply is very low, another source of milk is needed for a few days while the supply improves. Monitoring and follow-up. Follow up the mother and baby to check that the milk production or transfer is improving. So the frequency of follow-up would depend on the severity of the situation. Those babies who stay at the critical care unit should be seen as more frequently as possible during follow-up. Monitoring means more than just weighing the baby. Look for signs of improvement that you can point out to the mother, such as increased alertness, less crying, strong suck, more urine and stooling, and changes in her breasts such as fullness and leaking. Monitoring also gives you an opportunity to talk with the mother and see how the changes are working. Build her confidence and encourage things that she is doing well. So it is important that you encourage the mother to continue breastfeeding. If the baby's weight was very low and supplements were needed, reduce supplements as the situation improves. Continue to monitor the baby for a few weeks after supplements have stopped to ensure milk supply is sufficient. So in summary, a mother or her family may lack confidence in breastfeeding and think that the mother does not have enough milk. So you need to explain to the mother the reliable signs of milk intake. And these are the following: passing urine and stools, seeing the baby as alert and growing. Weight gain is a reliable sign if there is an accurate scale available and consecutive weight checks are on the same scales. So, build the mother's confidence in her ability to breastfeed. The most common reason for milk production is not enough milk is when baby is removed from the breast, so less milk is made. Common causes of low milk transfer are poor attachment, poor suckling, short or infrequent feeds, and the baby is ill or too weak to suck. Infants may lose 7 to 10% of the birth weight in the first few days after birth, but it usually regains its birth weight by 2 to 2nd weeks. If they start breastfeeding exclusively soon after birth, they may lose very little weight or none at all. Babies usually gain 100 to 200 grams, equivalent to 3.5 to 7 ounces per week during the first 6 months, and about 85 to 140 grams or 3 to 5 ounces per week in the second half of the first year. This weight should double by 6 months and triple by the age of 1 year. The practices of 10 steps to successful breastfeeding help to ensure an abundant milk supply. Use your communication skills to learn, observe, respond, and build confidence of the mother. You address the cause of low milk transfer, offer possible solutions to this, like improve attachment of the mother or improve attachment of the baby to the breast, increase frequency and duration of feed, avoid giving supplements or pacifiers, and for increasing milk production, you can tell the mother to breastfeed more often and for longer period of time. Tell her to express her milk between feeds and talk with the family about the support. Next is monitor and follow up until weight gain is adequate and mother is confident in caring her baby. The common reasons for low milk production are related to factors that limit the amount of milk the baby removes from the breast. If the milk is not removed, less milk is made, and these factors commonly include infrequent feeds, which may be due to the following: the mother's not noticing the signs of readiness to feed, or the Q signs, hunger signs, baby being sleepy or quiet, and looking to be fed, the mother being busy and postponing feeds, the baby is sleeping away from the mother, so the mother does not see or hear feeding signs, other foods and drink given to the baby, so the baby does not ask to be fed, the baby being given a pacifier or artificial teeth, or distracted instead of being fed, belief that the baby does not need night feeds, mother has sore nipples or sore breast and does not want to feed. Infants may lose 7 to 10% of their birth weight in the first days after birth but should regain birth weight by 2 to 3 weeks. If they start breastfeeding exclusively soon after delivery, they may lose very little weight or none at all. Babies usually gain 100 to 200 grams, or equivalent to 3.5 to 7 ounces per week during the first 6 months, and about 85 to 140 grams, equivalent to 3 to 5 ounces per week in the second half of the first year. They generally double their birth weight by 6 months and triple it by 1 year of age. The practices of the 10 steps to successful breastfeeding help to ensure an abundant milk supply. The following are the common reasons of low milk production. First is scheduled feeds. A schedule may not allow for frequent feeds. In addition, if the baby is left to cry until the scheduled time, he or she uses up energy and may be asleep at the scheduled feeding time. Second, short feeds. Babies who are well attached usually end the feed when they are finished. If the mother ends the feed at a set time or because she thinks a pause in suckling indicates that the feed is finished, the baby may not get enough milk. Third, not enough milk is removed. The inhibitor factor in milk collects and makes the breast stop producing milk. Fourth, poor suckling. A baby who is weak or poorly attached to the breast is not able to remove the milk from the breast. The milk is not removed, so less milk is made. Fifth reason is a delayed start to breastfeeding. Breastfeeding should start as soon as possible after birth. Uncommon reasons for low milk production are the following. Mother may take some medication like contraceptive that contain estrogen and can reduce milk supply. Diuretic therapy may also reduce milk supply. Alcohol and smoking may reduce milk supply. Mothers who underwent breast surgery wherein milk ducts are cut or nerves to the breast also cause low milk production. If a mother becomes pregnant again, she may notice a reduction in milk supply. The following are the very rare reasons for low milk production. Retained pieces of the placenta affect the hormones needed for milk production. Inadequate breast development during pregnancy so that few or no milk producing cells develop. Severe malnutrition. Milk is made from what the woman eats plus what is stored in her body. A mother needs to be severely malnourished and for a long time in order to cause low milk production. A very restricted fluid intake may also affect the milk supply. Breastfeeding ensures healthy, normal weight gain for infants. Many breastfed babies are leaner or less fat than artificially fed babies. Test weighing before and after one feed does not give a good indication of milk intake or production. The amount that a baby takes varies from feed to feed. Test weighing may worry the mother and reduce her confidence in breastfeeding, resulting to an attempt to give her baby supplements. A baby who is not gaining weight with good breastfeeding and good milk transfer may not have an illness. If the baby is feeding poorly or showing signs of illness, the baby should be seen by a doctor for medical treatment. However, if the baby seems willing to feed and has no signs of illness, then poor weight gain can be the result of not getting enough milk, which is often due to poor feeding technique. This baby and mother need help with proper attachment in order to establish breastfeeding. A baby with a condition such as congenital heart disease or neurological difficulty may be slow to gain weight even if there is sufficient milk supply and transfer. There is a need for weight monitoring for all children, including those who are not breastfeeding. Relactation. It means re-establishing milk production in a mother who has a greatly reduced milk production or has stopped breastfeeding. If a mother has stopped producing breast milk and wishes to breastfeed, the health worker can help her to relactate. Relactation may be needed because of the following reasons. The baby has been ill and not able to suck. The mother did not express her milk when her baby was unable to suck. The baby was not breastfed initially, and now the mother wants to breastfeed. The baby becomes ill or artificial feeds. The mother was ill and stopped breastfeeding. Or a woman has adopted a baby having previously breastfed her own children. A woman who wishes to relactate should be encouraged to the following. Let her baby suckle at the breast as often as possible, day and night for as long as the baby is willing to feed. Massage and express her breasts in between feeds, especially if baby is not willing to suckle frequently. Continue to give artificial feeds until milk supply is sufficient to her infant's growth. Seek support from her family to ensure that she has enough time to spend relactating. Drug therapy is sometimes used to increase or develop a milk supply. It is only effective if there is also increased stimulation of the breasts. It is easier to relactate if the baby is very young, which is less than 2 months of age and has not accustomed to using an artificial teat, or the mother gave birth recently or stopped breastfeeding recently. However, relactation is possible at any age of baby or time since breastfeeding is stopped. Even grandmothers may relactate to feed their grandchild.